And now I'd like to introduce you to Doug Ruth, who is the clinical director of our counseling department here at JFCS.
Trauma is essentially an event where if a person experiences trauma, they have a lifelong reaction or response to that. Trauma is anything where an incident puts, or a series of incidents puts undue stress on the brain, and then the brain responds. The brain literally rewires itself. And that the brain is impacted by that during the moment of trauma or moments of trauma, but it also stays with you. So trauma can then basically come back or present itself in new ways at different periods throughout the life cycle. And so by being a person-centered trauma-informed agency and by utilizing those types of services, we acknowledge that. And by acknowledging that, we work to give our clients a sense of trust, safety, and also some control over what's going on for them. Now, trauma can be any series of events. I mean, obvious ones right now are COVID and social justice movements that are occurring as we speak. Being a person-centered trauma-informed agency allows JFCS to acknowledge the effects of trauma on all the population that we work with. That may look like discrimination, it may look like war trauma, it may look like emotional abuse. All of these things are under the header of trauma. And by us acknowledging the impact that that has on the brain, this is basic brain science. When trauma occurs, the brain changes. And because the brain changes, we need to interact with the person differently in order to help them heal and help them find a way to process what's happened to them, and hopefully to build a better world for them. Survivors in many ways are our teachers, our guides through this process. I think when we're thinking about trauma, a lot of it is sort of how a person sees the world. If you've experienced trauma, it is the lens through which you walk through the world. We're very much formed by the experiences that we have, that have happened to us and that we've been involved in. When we work with clients, we strive to build we build empathy with clients. We try to understand the client from their strengths, from their full experience. One thing that's been said, and I think it really captures what's behind the efficacy of person-centered trauma-informed approaches is, we're asking clients, what happened to you, not what's wrong with you. And so at JFCS, we really strive to build that trust and safety with our clients, whoever they may be. JFCS does provide a safe space for people to seek and engage in counseling services in a way that they perhaps can't in other places, whether it be our experience with person-centered trauma-informed care or just the fact that we do support underserved populations. We do have a sliding scale program. We do provide Medicare services, which are often hard to find in the mental health realm. We do allow people to utilize the strength that they have instead of trying to fit the model that we create. We create our model based on our clients' experiences, and that's, in a sense, what trauma-informed care is.